Thank you. I want to thank FUS for funding this crazy idea. Multiple sclerosis is a very complex disease clinically, at least in part because the symptoms move around the patient. Sometimes they have peripheral pain in their left leg, sometimes they're depressed. And what's happening for these patients is that the lesions within their brains, this central disease, evolve in time, depending upon which flavor of multiple sclerosis you're cursed with. Sometimes a given lesion will form in a given place. The picture here, there it is, shows actual MR of a patient month by month by month. And for those of you who could see the little blue circles, that's highlighting in T2 this patient's multiple sclerosis lesion, which again, pops up in one place, goes away, popped up in another place, goes away. And every time a lesion moved, appeared, disappeared, their symptoms changed. For treating multiple sclerosis, which is an autoimmune disease, it's therefore of interest to decelerate demyelination. So multiple sclerosis, at the end of the day, is an autoimmune attack on the myelin that covers the nerves in the brain. And if one can decrease demyelination or increase re-myelination or start it, that's likely a good thing for patients. Paper appeared in Science about a year and a half ago, 2 years ago, where they took a mouse, they transgenically engineered a neuron to receive stimulation from a fiber optic probe placed near it. And what they observed was an increase in myelination, as well as oligodendrogenesis, associated with that stimulation. So they were able to make myelin grow in a transgenic mouse with a specific temporal pattern of light. Many of us know that with ultrasound, one can activate neural circuits. It occurred to us to test the following hypothesis, that ultrasound stimulation of nerves in an MS lesion, in this case a mouse model of an MS lesion, with the same temporal pattern as that given by this fiber optic based stimulation of a transgenic mouse, could have some positive effect on the myelin in these MS lesions. This was a lot of work. It's a lot of exploratory work. In the 30 seconds I have left, I'll only tell you two things. The first thing is that it looks like when you apply ultrasound transcranially to an MS mouse, that the kinds of electrical activity you measure, if we measured, can differ compared to when applied to a naive mouse. We worked with 2 megahertz, 1 megahertz, and 0.65 megahertz, thinking about those MRI guided ultrasound systems that are out there. And this is an example. On your left, we're looking at signals collected transdermally, not transcranially, not intracranially rather, with EEG electrodes. We saw more activation in the multiple sclerosis mouse, and this seems consistent across the protocols. That's the first result. God bless you. I teach a lot, so I pick on my students all the time. Okay, the second result really puzzles me, but it's positive, so that excites me also. So we looked at mice whose lesions were demyelinating because they were eating nasty copper-based food. We didn't seem to change the myelin content in those animals. We also looked at mice whose MS lesions were re-myelinating. That is, we stopped feeding them the nasty food, and then, as happens in this animal model, the myelin comes back. And this is a myelin stain. We applied ultrasound right around there. There's the corpus callosum, there's the hippocampus. And where it's dark, there's more myelin. And for one protocol, that is one of the 3 ultrasound frequencies in us, we found an increase in myelin. It's darker where we applied the ultrasound than on the contralateral side where we didn't apply the ultrasound. And I'm not sure I would believe what I'm saying if I were staring at that slide either. If you come look at my microscope slide, you can see it. All this was to screen so we know what to focus on for the rest of the studies in this funded work. Thank you again, FUSIF. To do a more detailed study of this protocol on re-myelinating mouse brain, and to bolster what is thus far as pilot data, and to do electron microscopy on these mice to actually measure the myelin itself rather than work on essentially stain density. Future work will, funding willing, will go from a cuprizone model, that's the copper-based food that we use to feed these animals, and work with an autoimmune model. Much more work to establish, so we wanted to go with cuprizone first. And then, assuming results are positive, we will attempt to optimize the effect. Thank you very much.
So I've done MS for 20 years and studied this model as well as other EAE models, and the variability in the model and the remyelination can be really, across animals can be really quite large. And thinking about oligodendrocytes and the sensitivity to what kind of cytokine changes you could be generating in the microenvironment, you have to start thinking, you have to start being concerned about what kind of immune reaction and how, because oligodendrocytes in particular are very sensitive to TNF-alpha, and they can die. You would have, I mean, this is very interesting work. Better to move into the EAE model than the cuprizone model, because they then demyelinate and they form black holes, essentially, in the white matter. And also neurons, especially in the mouse model, remyelinate in the brain. In a cord, it's a little bit harder. I think this is going to be a lot harder to do in a cord, where most of the EAE starts. But it's certainly an interesting start, and it's going to be very interesting to see what your MT magnetization transfer imaging in the MR looks like, whether or not your diffusion tensor imaging looks any different, as well as especially what the EMs are going to look like, whether or not you're remyelinating small or large axons in white matter. So that's just a comment. It's not really a question, but I think
it's a great one. Thank you for that.